This is a case of venous congestion in the shoulder posing as a continuation of a previous infection. Conflicts of interest: I'm a stockholder with Sonex Health and co-editor of a textbook on MSK ultrasound. The patient is in his early 40s and has a history of methamphetamine abuse, leading to some renal failure. The shoulder is on the left side, which is the same side as his arteriovenous fistula. And 10 days previous to the operation that we're reporting, he had had a glenohumeral pyarthrosis, which was successfully treated with an arthroscopic washout and antibiotics. That washout included the subacromial space. A new orthopedic surgery was called, and based on a repeat MRI, that there seemed to be a mass on top of the muscle belly of supraspinatus. In the short axis of MRI of the supraspinatus muscle, we can see this mass, which in this slice is as big as the muscle portion, and it seems to be contained within the fascia of the supraspinatus. Here's an ultrasound over the mass. In this particular section, the mass is bigger than the muscle belly of the supraspinatus. So we decided that we would approach this through trapezius, either as a needle biopsy or as an open biopsy. Here is a long axis view of the same mystery structure. Ultrasound was done to plan our approach, and what we found is a large number of dilated blood vessels on the inferior surface or deep surface of trapezius. Doppler confirms that the hypervascularity. And so we went through the subacromial portal rather than going through the trapezius muscle itself. This is a sucker playing with the mass to see if we can get some fluid. It's really roughly the consistency of a lipoma. As no fluid was obtained, we thought we should place a Jackson-Pratt drain, as this may be a phlegmon that is becoming an abscess. Postoperatively, there was no fluid obtained, and the drain was pulled, but the patient continued to have pain and stiffness. Remember the dilated vessels on the undersurface of the trapezius. Well, the diagnosis was made on venography through his fistula, and what we found is that there is a relative narrowing at the junction of the subclavian system with the main venous system. So, in fact, with this narrowing is not really the primary cause by itself, but we find this in a system that's been overloaded by our arteriovenous fistula, and this was treated with dilation of the narrowing. This proved to be effective. At a 3-week visit, there was a great decrease in the swelling and pain, and a great increase in the glenohumeral portion of his shoulder motion, from just about no motion at all to about 50% of what would be seen in his opposite shoulder. Thank you for your attention.